Question 8. Again, I call the Honourable Member for Onchan.
Thank you, Mr President. I'd like to ask the Minister for Health and Social Care, perhaps it's not when now, it's if the Somerset Cancer Register was implemented in his department.
Minister to reply.
Mr President, I didn't want to preempt the answer to this, which is why I didn't mention it, but the Somerset Cancer Register is a software application which tracks a cancer patient's journey from the point of referral into Nobles Hospital and throughout the patient's cancer journey, so is in place. The SCR is predominantly used by the cancer MDT coordinators to input patient data such as diagnostic dates, treatment commencement dates and decisions made at MTD meetings by healthcare professionals. By using the Somerset Cancer Register, our cancer MDT coordinators can oversee each cancer patient's journey and liaise with clinical teams within the department and wider providers to ensure that our cancer patients are progressing through their journey in a timely manner wherever possible.
Supplementary, Ms Edge.
Thank you, Mr President. Thank the Minister for that response, and pleased that this register is in place. Frequently in here we hear there isn't data available on statistics, and certainly some of the data around some areas of cancer treatment have been very vague. Can the Minister confirm that he's confident that the recording of all cases are within this Somerset Cancer Register, and that data we are receiving in here in this Honourable Court is up to date and accurate?
Minister to reply.
Thank you, Mr President. Yes, all cases are recorded within the register and the data is up to date and accurate. We've been rolling, obviously, the register out over a number of years. So, for instance, in terms of what we'd refer to as cancer sites, upper GI came in 2013, the head and neck in 2015, skin in 2017, paediatric in 2018. So it's been building a picture over time, Mr President, and obviously it's also been feeding into where we report on our weekly 2-week weights as well. So 13 sites are currently monitored in this way. There is still more work to do around the data and having it in a format where we can extract it quickly and publish that data.
Honourable Member for Ramsey, Dr Allenson.
Thank you, Mr President. Would the Minister agree with me that the work of GPs in automating the referrals for suspected cancer cases through the 2-week rule, using proformers and electronic sending of those proformers, has actually helped greatly speed up the transition so that people get the care and attention that they need?
Minister to reply.
I would most certainly agree with the Honourable Member for Ramsey, Dr Allenson.
Final supplementary, Ms Edge.
Thank you, Mr President. I'd just like the Minister to confirm that obviously this register will be kept going. Obviously, he said this report really has not been implemented in any way, shape or form, but this has. So this register will be continued during the transformation process.
Minister.
Swiftest answer of the day, Mr President, yes.